No one wants to be in a hospital. Constant alarms, restless sleep, infection risks. Whenever possible, patients want to return to their routine, their homes, as soon as possible. And in fact, it often makes sense for care to be delivered at home, a practice that is becoming more common for people managing chronic conditions. As hospital lengths of stay decrease, more people are recovering from acute illness in their own homes. But unlike hospital or exam rooms, no two homes are alike, and no two patients are alike. Care recipients are young or old, temporarily disabled, chronically ill, or at the end of life, living in rural or urban settings, rich, poor, or somewhere in between. With all of these variables, how do we ensure the safety of care recipients and their caregivers in the home? IHI convened a panel of subject matter experts to look at the existing landscape and consider an ideal future state for care in the home. The panel agreed upon 5 principles that should guide every decision and action related to home care. The first principle holds that self-determination and person-centered care are fundamental to all aspects of care in the home setting. Essentially, this means that care in the home must provide a balance between the care recipient's autonomy and efforts to mitigate harm risk. Secondly, every organization providing care in the home must create and maintain a safety culture. It's important to remember that harm to care recipients in health settings, such as infections, medication errors, and pressure injuries, also occur in the home. Third, a robust learning and improvement system is necessary to achieve and sustain gains in safety. Components of such a system include leadership, transparency, reliability, and methods of improvement and measurement to drive continuous learning. Fourth, effective team-based care and care coordination are critical to safety in the home setting. Improving care coordination can help reduce the risk of errors, especially at care transitions and for care recipients with multiple providers, which also helps reduce the stress and complexity for those care recipients and family caregivers. And fifth, policies and funding models must drive the provision of high-quality coordinated care in the home and avoid perpetuating care fragmentation related to payment. All stakeholders can and need to take action to improve the safety of home care. To learn more, read our full report.